Hi, I'm Jessica Steyer, and I'm enthusiastically submitting my application for the Robert Wood Johnson Foundation's Culture of Health Leaders program.
An evidence-based quality intervention that I'm passionate about implementing is the organizational and cultural enhancement for the practice environment. I asked the experts, why should we dedicate our time, energy, and funding on organizational and cultural enhancement for the practice environment, and why focus on nurses in particular?
I've been a bedside nurse, a nurse manager, and a nurse executive, so I recognize the value of a healthcare organization and how it is intrinsically linked to a culture of safety and quality. In fact, process and procedural interventions to improve patient quality have limited utility in an organization with poor culture and lacking employee engagement.
Medical errors are the third leading cause of death in the United States, yet as many as 42% of healthcare-related life-threatening events and 28% of adverse medication reactions are preventable. As the largest group of employees in hospital settings who deliver the majority of direct patient care, nurses are key drivers of patient outcomes.
Of late, we've been applying our culture change interventions and solutions in the healthcare sector for two major reasons. One, it happens to be an industry or a sector where best practices in terms of workplace culture and workplace dynamics haven't really infiltrated as effectively as the corporate environment. And secondly, it is one of those industries that probably is the most important for those types of dynamics and that type of culture, this positive workplace culture to take place, primarily because of the effects that workplace culture and those dynamics have on patient outcomes.
Adverse events are a significant issue for hospitals, and although they're largely preventable, they are costly. Annual treatment costs for inpatient adverse events are estimated to be between $18 to $32 billion. According to the 2008 Surgeon General report, 1 in 7, or 13.5% of Medicare beneficiaries experienced an adverse event during their hospital stay. Nearly half of these, or 44%, were preventable. Frontline nursing care is a fundamental driver of patient outcomes. Improving elements of the nursing practice environment and nurse culture has been shown to reduce adverse events. Through this intervention, we hope to minimize medical errors and hospital-acquired infection rates, improve quality outcomes and satisfaction, and ultimately decrease cost.